Hey guys, this is Dr. Joe McGowan at May River Dermatology, board certified dermatologist and Mohs micrographic surgeon. You guys are probably familiar with the pre-op checklist, the preoperative checklist that accompanies all of the surgeries that we do here. A lot of times people can get annoyed or irritated that we have to call so many times to kind of go over some things, because some people, assume that we should understand that their health care, their interval health record has not changed. But we're just very thorough because we know that anytime we take time to make these recommendations, then you guys are going to be safer and we're going to ensure that you have the best outcome possible. And that's what we want to do. We just want to keep you guys healthy and safe. Now, two things that we do to prevent infections is a surgical scrub called Hibiclens and antibiotics, pre-op antibiotics. We don't do pre-op antibiotics in all cases, but for certain locations we do. And so we would ask that you trust our advice, because we know that these protocols have been not only supported by the literature, but we have put them into practice and they have been serving our patient population well. Vastly reduce your risk for a post-op infection and keeping them safe for years. So let's talk about the Hibiclens scrub. The Hibiclens scrub is to be used the day before the surgery from the neck down. It only needs to be used once. You do not want to use this as your daily soap to wash your body, because it's too sort of abrasive to the skin. It can have a drying effect. It also does not need to be used on open wounds. You never want to use it on your face. Specifically avoid any contact at all with the ears or the eyes. Remember that when you go to the pharmacy, it is not a prescription, but you have to look for it and may need to ask for the pharmacist to help you find it, because they sometimes keep it in the back or in a restricted area. The next thing is antibiotics. Preoperative antibiotics are not routinely given by any of us here, but in certain locations, including the ear, the hands, the feet, or the legs distal to the knee, there is a higher risk of a post-op infection. These are areas that are typically more exposed to the elements, especially in the summertime. The legs, the feet, the hands, they're more likely to be in contact with something that could be an infective source. For this reason, we have a protocol that gives you a short course of antibiotics the day or 2 days before the surgery, in order to reduce the likelihood of you getting an infection. One thing I wanted to clarify was that just because we're doing the antibiotics does not mean that the surgery that we're going to do is more involved or the cancer itself is more aggressive. So in review, when we have our staff call, please ask as many questions as you need to. We're happy to explain it, but I hope that these explanations will give you better comfort or understanding as to why these measures may be very effective in getting you the best outcome possible and to do it safely. Again, guys, this is Dr. Joe McGowan. Thanks for tuning in. More tips to come, and wear sunscreen, guys.